The following program is intended to educate the public on a variety of cosmetic procedures and is paid for by the participating doctors.
I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different procedures today. First up, breast aug revision, followed by liposuction, then post-bariatric surgery, which is a big deal now, and finally, breast implant removal. Before we get started, any advice we give you today, remember, consult your own physician first, but let's jump right in. Hi, Dr. Mealy.
Hi, nice to be here.
Thank you again for joining us at the studio. Love to have you.
Sure.
We're talking about breast aug revision. Now, we know breast aug is a big deal, but breast aug revision, a lot of people, you know, they have breast augmentations done and they may be botched a little bit, and it leaves them hopeless, absolutely not knowing what to do, and it's kind of devastating.
Yeah, well, I wouldn't say a lot of people, but it does happen.
Well, yeah, it does happen.
And I think because it doesn't happen often, it makes it a little harder for that person.
Right.
But there are things we can do.
There are things we can do. So you are telling us that there are things we can do. There's a little bit of hope.
Yes, and it depends on what the problem is.
Absolutely.
I mean, there's some things that are subjective, like size.
Right.
And that's something we'll always try very hard before surgery to communicate and figure out.
Exactly.
And there are other things that are objective, like the implants become hard, or they move position, or they're too high, too low, too close together even. Those are things that can be fixed.
More easily than other things.
Sure.
Okay, well, let's go into the pictures and take a look. First picture we have here.
So this is someone who had a nice outcome and then started to get what's called implant exposure.
You can see that at the bottom
the
there.
lower part of that breast that's in front, it looks square. That's the implant actually pushing its way down into the skin, thinning the skin out. It was almost a purple color, almost translucent. So the implants have to be removed.
Yes.
So I removed the implants, had to remove some of that skin too in order to get a good closure. Usually we'll wait 3 to 6 months, and then we can go back and replace them.
And picture number 2 is the replacement of that.
Correct.
Wow.
So she had some asymmetry in size also. It's a little harder to tell from the oblique view, but her right breast was much larger than the left, which was really obvious when I took the implants out, and one was much bigger than the other. So I replaced them asymmetrically too, and these are put back underneath the muscle, which gives her more tissue to protect her skin, and it worked out well.
The outcome is beautiful now. Now, she got those replaced because they were actually coming, you know, underneath. So, I mean, is she fine now? Will she have to replace those again later on? It's pretty good.
Hopefully not for this reason.
Gotcha.
You know, so we did a couple things. We like to change the size. We can go smaller. Sometimes the body's telling us it's just too big. We wanted to put several layers of repair, so the skin's repaired as well as the muscle underneath, so it should be well protected.
For revision, is downtime more or less? What was the downtime for that one?
Usually less.
Okay.
With the exception of when we're doing complete capsulectomies, we have to remove the entire scar around the implant. Then that may be as sore as the first time, but the rest of them usually are less.
All right, picture 3, what are we looking at?
So this is capsular contracture. So the capsule has become tight on that right side. Her breast is pushed up. The little square blocking her nipple smaller because the nipple is not being stretched. The implant's all the way in the top of the breast. She was happy with the left side.
Yeah,
so if people are happy with the left side, then we just try to match.
Gotcha.
If they're unhappy, then we'll maybe do something on both sides. So in this case, done a capsulectomy, removed the capsule, lowered the implant, and replaced it.
That is a beautiful outcome, very natural look. And a lot of people get that capsular contraction, or what do you call that?
It can happen. It's just 15% of the time.
It just hardens, right?
Yeah.
Oh.
So the capsule is very important. It keeps the implant from moving so it doesn't bottom out. But if it's too tight, it begins to shape the implant and move it.
If you have that problem, are you going to get it again? Is that just kind of a body thing, or is it just?
You may. I think you're at a little higher risk, but it's not like twice the risk or anything like that.
All right, next picture.
So here's someone who had a deflation on her right side.
Yes, you can totally see that.
And the left side had a little bit of sort of a waterfall deformity where the breast is sort of falling off the implant. So what I've done is take out both implants and replace them with a little bit larger implants because she wanted to be a little bigger too.
It's a great
that kind of balanced things out because she had extra skin, so adding a little volume took care of it.
Wonderful, very natural on the after picture. Now, a lot of women ask, can you nurse if you have breast augmentation? Can you still nurse babies?
You can. I mean, if you're happy with your breasts, have children first and then get it fixed. But if someone's born with very small breasts, you know, you can have breast augmentation, and then the recommendation is to go ahead and breastfeed like anyone else would. Yeah.
Well, that's good to know.
The only downside, you may make a little less milk.
Okay.
Because the breast is filled with implant and they think it's full of milk already. But it doesn't change it, doesn't taint it.
Go to the store and buy some more.
There you go.
And our last picture?
So this is someone with symastia and a little bottoming out on the right side.
That.
So this happens a lot with implants that are oversized, especially the high-profile implants that are oversized. You could think of the implants like the towers on the Golden Gate Bridge.
Yes.
So if you make the towers higher, it starts to lift the cables
right.
up. Well, that skin is like the cable. So It's been lifted off the sternum, and there's actually space there.
That's crazy.
So I've removed the implants, closed off that pocket immediately so that the implants are separated, made a new pocket to keep them in, and then I downsized her a little bit to try and keep that from happening again.
That is a big revision because
there are
that's
times
hard
when we
to
have to take the implants out and let it heal.
Wow.
And then come back and do this, but sometimes we can do it as one sitting.
So what you're saying is in the before picture, the implants could go back and forth almost. There was nothing stopping them.
Correct. So if I pushed on the left breast, it would go across the midline of the right and vice versa.
You know, it seems like such an easy thing to revise or fix, but that is not easy.
That's a tough one.
Yeah, that is a tough one. All right, well, in the next picture, or the after picture, what was the downtime with that? Did that take a lot more work because of the closing of the
It's sore in the middle where I've done the repair, but really the hard part with recovery is not overexerting, because you have to let that area settle down. So there's special bras that have a little, like a pad in the middle, like a thong bra, that helps keep that skin down. But if you're overworking the muscles, then it's going to be a problem.
And when can you work out again?
For something like that, it may be 4 to 6 weeks.
Okay.
But for regular breast augmentation, usually 2.
All right, well, thank you. That is it for breast augmentation revision. We have lots more. Come back on Body Beautiful in just a minute. If you want more information, just go to the doctor's website. That is drmealy.com or sanfranciscobreast.com, or just call his office, 925-943-6353. We'll be right back.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.